Hi, I wanted to talk to you about Bell's palsy today, which is a temporary paralysis of the facial nerve, which usually can be found around here. The facial nerve originally comes through the styloid-mastoid process, foramen, which is right just underneath the back of your ear here. And then there are slips of nerves which come forward and go through an area called the parotid area, which is where the parotid gland sits, just in front of your ear. When the nerves get pinched, either because of inflammation or localized infection around there, or a direct blow, either to the back of the head here or to the face, a punch or what have you, or because of an infection. Herpes zoster is probably one of the most common ones, or an infection in the parotid gland for children in particular. The 5 branches of the facial nerve can get affected. The most common symptom is a facial paralysis or a facial droop. So you find that they can't open their eye properly. They can't smile, so you can smile on one side of your face and not the other. It droops, you lose the labial fold. They can't pick the corner of their mouth up, so you end up with dribbling on one side. This is very hard for me to do. They can't smile equally. You end up with a lopsided smile, whichever nerve side is affected. You can also lose the taste in the front part of that side of the tongue, and you can end up with earache or a tinnitus, which is a buzzing sound or an abnormal sound in the ear during normal function. Now, the good news is that this is a temporary state of affairs. As soon as that nerve or nerves get clear of the impingement, then they start to heal. The really good news is that osteopathy can help enormously during this process. Over my 30 odd years of practice, I've treated quite a number of Bell's palsy clients, and if they come and see me within the first 24, 48 hours, maybe 72 hours, you can make remarkable differences within a couple of minutes sometimes. The longer the situation is allowed to stay like that for, the more damage to the nerve and the longer it takes to heal. Nerves do not heal from compression very quickly. If you go and see your doctor, first of all, they need to make sure that you're not having a stroke. Obviously, facial paralysis can be a sign of a stroke, and difficulty speaking, because the facial nerve organizes these mouth muscles, partly tongue, but mainly around the jaw itself. So if you end up with Bell's palsy, you end up slurring your words because one side of your face isn't doing the same as the other, which is not the same as a stroke caused by a bleed in the skull itself. But if they're pretty sure that it's Bell's palsy and it's not that difficult to diagnose, they may suggest that you have some steroid tablets, some prednisolone, to reduce the inflammation down. As a holistic practitioner, as an osteopath and cranial osteopath in particular, I work around the exit of the facial nerve from its facial nucleus in the base of the brain, and as it exits through the styloid-mastoid foramen, which is a really small little foramen in the base of the skull. And the facial nerve, because it has such a lot of nerves and innervations for our face, is actually quite a chunky nerve. We often have to work around the jaw itself, through the parotid gland, coming down underneath. Sometimes we have to work on the branches up into the face here, obviously to the eye, nose. You can end up with more tearing up with the eyelid droop, you end up often with a dry eye, and that can be really A, uncomfortable, B, severely damaging for the eye. So that's something to be really aware of. You might need to have your eye literally taped closed to keep it hydrated, and you may often be given drops. But with osteopathic treatment and some advice of what you can do to help, the results can be remarkable. This week I treated one of my clients. I haven't seen her for a couple of years, and I had treated her brother 17 odd years ago for Bell's palsy, and he had complete remission within a day or two. I treated her on Thursday. I will be treating her again on Tuesday evening. She could feel while I was treating how everything was beginning to open up and start to operate. I worked not only around the skull and the head itself and the muscles, but also down into the neck, which was restricted, the upper back and chest. She's been quite stressed for a while. She's had a few trauma. So quite what caused the actual problem, Bell's palsy typically comes on relatively slowly. She'd had it for about 24 hours or so before I saw her. But luckily her mum remembered that she'd brought her brother, so she came in as well. And although there's a bit more work to do, I know that it's already made a significant difference, and she's feeling much more positive about the whole thing. So if you are concerned that you have Bell's palsy, you actually have been diagnosed with Bell's palsy, do come in and have an osteopathic cranial treatment. It makes a massive difference. If you've got questions, by all means, drop me a line. You can book in on the clinic website, which is livingelements.co.uk, and in the blog post I will explain a little bit more as well. So that's Gayle Palmer at the Living Elements Clinic near Chichester in West Sussex, where your health is my priority. Take care for now. Bye-bye.